Have you ever wondered what's going on in your head when you have a headache? Or Chris Stanford and Leah Lynchide share more with their weekly conversation with Dr. Rupa Shah.
Everyone gets a headache now and then, but what causes them and when should you start worrying about them?
SSM health physician and wellness coach Dr. Rupa Shah joins us now with our weekly health conversation. Good morning, doctor.
Good morning.
So, what's going on inside of our bodies when we have a headache?
Yeah.
So headaches are one of the most common types of pain that people actually experience, and there's lots of different types of headaches, but the most common one is a tension headache. And so this is usually due to those tight muscles in your shoulders, your neck, your scalp, your jaw, a lot of times from the way that we sit all day at our computers and our desks. And they can also be related to stress, anxiety, depression, and you're most likely to get tension headaches if you might work too much, you don't get enough sleep, you miss meals, or if you misuse alcohol.
What are some other sources of headaches?
Well, there's, like I mentioned, many different types of headaches. Some people have migraines. There's also cluster headaches, exertional headaches, sinus headaches. So they can be due to a lot of underlying health conditions. Some people suffer from chronic daily, headaches. But to be diagnosed with a chronic daily headache, you usually have headaches for more than 15 days out of the month for usually 3 months in a row.
At what point should we be talking about this with our doctor?
Yeah, so this is a great question, and here's some things that you should be looking for. If you develop headaches after the age of 50, this could be a cause for concern, so you should mention that to your doctor. Any major change in the pattern of your headaches, any unusually severe headache or one that's worsening, any headache that comes with a stiff neck, a fever, confusion, any neurological symptoms like slurred speech, any headache that comes after an injury, a fall, or a big blow to the head, and any headache that comes on abruptly, especially if they wake you up out of your sleep. Make sure you talk to your doctor about those.
Now, migraines, those are a whole other beast, right?
Yes, definitely. Migraines are one of the most severe types of headache that some people suffer from, and they're more common in women than men. And a lot of times they do have a genetic component to them, meaning that somebody else in your family may also suffer from migraines. Migraines usually have a trigger that will set them off for a lot of people. This can be very common things like changes in weather, changes in like atmospheric pressure, humidity, heat, lack of sleep, or even oversleeping. Fatigue, stress, anxiety, staring at your computer for too long, flickering lights, loud noises, strong smells can cause this. And for some people, even dietary things, drinking red wine, having certain aged cheeses can trigger a migraine. And even sometimes increases or decreases the amount of caffeine that you have in your diet.
So if I get like a run-of-the-mill headache, what's the easiest thing I can do to get rid of it?
Yeah, so one of the few basic things that people can do is taking the occasional Tylenol or potentially ibuprofen, but making sure you don't take more than the recommended dose. Things like a heating pad can be really helpful. I also really like recommending to my patients like massage or even acupuncture sometimes. And then if you suffer from kind of chronic daily tension headaches that are becoming more of an issue, you might want to talk to your doctor because sometimes things like physical therapy can also be very helpful for these types of headaches.
All right, doctor, where can we find you on social media?
So you can find me on Facebook or Instagram at Wellness with Dr. Shah.
Thanks again, Dr. Shah.
Thank you.